Good afternoon, everybody. Welcome to this session. We're going to be running this session for an hour. It's actually a new topic that we've sort of publicly presented on, and very much looking forward to sort of co-hosting the session. So my name's Rich Middleton. I head up the customer success team at Thrive. And with me, I have my co-host, Andreas. Andreas, if you want to give a quick intro.
Yes, hello everybody. Good afternoon. I'm Andres Fonseca. I'm the chief exec at Thrive, and I'm a consultant psychiatrist by background.
Fantastic. And it's great to have you here, Andreas, to sort of walk us through some of these topics. And I guess just to give a bit of context as to where this idea for this session came from. Those of you that know as well will know that we provide our mental health service to employers, sometimes through insurers. And a lot of our topics tend to focus on the end user and things that the individual can do to support their mental health. We wanted to do this session today with a little bit more of a focus on how potentially organizations, people within roles that potentially are procuring services like Thrive, can look at this subject of measuring outcomes and impact from solutions like Thrive Service. So what we're going to do today, we are going to cover the topics that you can see on the screen in front of you. We'll spend a little bit of time talking about the sort of target audience, if you like, that we're trying to address within an employee population. We'll talk through engagement and specifically its relation to outcomes. And then we'll delve into these three topics. Prevention feels to me very topical at the moment. We are hearing a lot of customers and clients talking about the role of prevention. We're going to unpack that for you in respect to mental health. We will talk about early intervention and the themes of resilience, and then we will spend the latter part of the webinar talking about some of the outcomes that are important, what you can measure from a perspective of mental health outcomes, and of course, how do you go beyond that sort of human impact? Because, you know, businesses want to be able to illustrate that they are getting, if you like, bang for their buck and getting a return on that investment. So that's the sort of makeup of the session today, and we are going to start with this, which is who are we actually trying to reach when we think about a service like Thrive. In my role, which is customer facing, often dealing with stakeholders, they might be budget holders. You sometimes get the comments, we want more people using this regularly, things like that. And I think it's very important for us to try and outline who we are trying to help within an employee population. And just to sort of give that a bit more context from a customer success perspective, we want all of your employees to be aware of the Thrive solution, but we're going to use a little visual aid to hopefully illustrate some of the cohorts, if you like, that sit within an employee population. And if I can invite you, Andres, to sort of talk a little bit more about what we see on screen.
Yeah, absolutely. So the reason we are thinking about it this way is because it's an emerging there's emerging evidence on the fact that perhaps if you are intending to get the whole population to be using something that ultimately aims to treat a mental health condition, you may be causing some problems. So the best way to understand it is that if you need support and help, then you should be able to readily access it and be able to sort of have almost no friction and be able to benefit from it almost immediately. But if you do not, then being excessively preoccupied with your own mental health and whether you are well or unwell may have some detrimental effects. So that's the thinking behind it. So the blue bar represents the people who are not symptomatic at all. So they don't have any symptoms of mental health. They're doing well. They're fine. Those people, our aim would be, as Richard says, that they are aware of our service through various means, and how we make them aware of our service depends. But we don't necessarily want them to be using our service because they're not symptomatic. it's unlikely that they're going to benefit from it. There's a small box there that says well-being aware. So there's some people in every population, it's about 10%, so that box is a bit larger than it probably should be, that are very health conscious, and they do a lot of activities to improve their own health. So they are the people that actually are very diligent with going to the gym, going for a run. They do a lot for their health. So we just have to be realistic that those people are very likely to join the service. But also, I mean, interestingly, they are likely to use it well. So they're not likely to be excessively preoccupied. Also, in some cases, these people who are who are very well-being aware, could also be driving themselves to doing a bit too much, and that could also be detrimental. There's some emerging evidence in that area. So it's about maintaining a nice balance, and about using the things that you actually need, but to be aware of everything. So there's a box in the middle there that says symptomatic, and it's about 14 to 16% of any population. So these people, if you look at the way they're presenting, they will have some symptoms, perhaps of anxiety, perhaps of depression, perhaps they may have things like poor self-esteem, or they may have some things that if you run some kind of a diagnostic questionnaire with them, they will flag they will endorse some of the symptoms, but they wouldn't make it to having a full-blown diagnosis, as it were, right? However, these people are more at risk of developing a condition, of that condition progressing into an actual diagnostic threshold, so becoming unwell, let's say, but also they are already suffering from the fact that they experience this. They're already distressed by the fact that they experience these symptoms, perhaps not very significantly, but sufficiently that is worth doing something about them. And in that's a population of interest for us. So trying to identify these people that endorse some of these symptoms, we believe that we can help them, and we believe that we can produce a good outcome for them. So identifying them, being able to enroll them in the service is important for us. And then obviously we've got that 14 to 16%, which actually meet the clinical threshold. So they endorse enough symptoms, and they have enough, the level of distress is enough, and the level of dysfunction is enough that we consider them to have either a mild, moderate, or severe presentation of a condition. Those definitely we don't want to miss. We don't want to miss any of them. It's very important that they are very well aware of our service, and that we're very well able to enroll them, because we know that we can produce a good outcome for them. We know that we can resolve their condition, and we can help them thrive again. We can help them recover. So that's very important. So that's the way we think about a population. Now, the fact that you're in the symptomatic bucket today doesn't mean that you will remain tomorrow, right? So that may be circumstantial. So you may become well again, and then we don't need to worry too much about you. And the fact that you're in the blue bar, that you're well, doesn't mean that you're always going to be in the blue bar. So as time goes by, you could migrate into the symptomatic, or even into the you meet threshold for a condition bucket. And so that's why it's important to have the reminder for the population that we exist. So if your situation changes, you're able to access the service, you're able to sort of benefit from it. And that is a bit of a challenge, because we know that people who are symptomatic in the moment we launch, for example, with a client, we do capture a lot of this unwell population, a lot of this symptomatic population, for sure. We know that from our own numbers, right? Because if you look at a point, what we call a point prevalence, we know our numbers are very close to what we expect, right? If we do a good launch, right? The problem is that 6 months later, we know that there will be new people in the symptomatic bracket, in the unwell bracket, that they probably won't join, because they're no longer aware of the service. There was a big launch done at the beginning. People were aware. People who would benefit from the service became aware of it, used it. But later on, that doesn't happen, and people who are becoming unwell would have forgotten that they have access to this. That's why it's important to keep, in terms of customer success, what Richard was saying, to keep reminding a population that we exist, not in a way to force them to use anything, but so that they're aware, and if it becomes relevant for them, they can actually access it.
Thank you, Andres, and I appreciate you banging the drum for my team's work. And it's really important, right? Because we do see that success and traction at launch when there's a lot of attention on the sort of launch of the service, but it's about, working with those organizations and thinking about routes to employees, not just at that point of launch. So hopefully that's given a bit of context, I guess, of how we sort of view the world and look at an employee population who we're trying to engage, and we're trying to make the service aware and available to people across the whole sort of width of that visual. So we'll move on to the next slide. So one of the challenges I think you have with thinking and talking about engagement, particularly when you have various different types of digital services, is and we do hear this from customers, and I think we're trying our part to sort of educate the market with our view on things, that engagement is important, but engagement shouldn't be the primary aim or overarching thing that you fixate on, because we need a certain level of engagement, right, to deliver outcomes. And then the other challenge that you have with engagement is that people measure engagement in different ways. So for one provider or service or an app, for example, it might be someone that's opened a session. For another one, it might be completed a session. For another, it might be sort of adherence to treatment. So I want to spend a little bit of time, Andres, and I've stolen this from something that you sometimes say. So why don't you talk a little bit more about sort of the view on engagement and what we're not.
Yeah. I mean, so it's confusing for me. It's confusing what I'm going to call intermediate measures with real outcomes, right? So what is a real outcome for our service? A real outcome for our service is somebody who isn't well, who wasn't well, or symptomatic, like we said before, who actually goes and recovers. That is a good result. I'm happy. We've done a good job. They are recovered. They've recovered. They're back to work. They are productive. They feel good about themselves. Fantastic. That's what we want. If we just measure only engagement in this circumstance, and we optimize for that, and there's some evidence that some mental health services optimize for that, you may very well get a lot of usage, and you may very well not get any outcomes. So that's why I'm saying we're not Netflix, in that, yes, you can get, or TikTok, or whatever it is, you can get a lot of engagement out of those apps, but if you measure the mental health outcomes, you may discover that, I mean, Netflix is probably neutral, but if you measure TikTok or others, it might actually be detrimental. So they're getting wonderful engagement, but it's actually harmful. Yeah. So that's the problem with engagement. You can optimize for engagement and end up with something that actually harms your mental health. Now, the problem with trying to treat a mental health condition is that it's hard work. So if you want to recover from something, it requires a lot of dedication. It is hard. Your whole instincts while you're going through the process is to stop because it's difficult, because it's hard, and therefore, that's where engagement becomes really relevant for us. Is, can we get somebody through this difficult, process with a successful outcome? So we know that at that stage, then engagement and adherence to treatment is extremely important. And that the way you optimize for that is very different to the way you optimize for general engagement of something that is very easy to use, very pleasant to use, like a nice meditation session. A nice meditation session is a bit rewarding, is nice. If you like that sort of thing, then you're not asked to do very much or to do anything difficult. You're just asked to sit there and relax, and you'll feel good for about 5 minutes, 10 minutes, but you're not going to fundamentally change your outcomes. Particularly if you're unwell, you're not going to recover from your condition. So, and we know that people do that. So we've done our own survey on this topic, and it seems that people who are actually very symptomatic are not able to differentiate between the nice one that doesn't give them any results or any outcomes, but it's actually quite good to engage, very easy to engage with, very effortless to engage with the one that actually is hard to engage with, but actually will prove beneficial, will actually give them a result. So that's the challenge. So for us, What we're trying to optimize for in terms of engagement is not that free, easy, I get a good feeling after using it and it's wonderful side. We're trying to optimize for engagement when we're trying to get you to do something quite hard. And that's actually a very difficult, it's a difficult challenge. And we have to show you the value of why doing something that you're going to find difficult is going to pay off for you. That's the challenge for us. So you can see that the way you even articulate this argument is very different in both cases. In one is, oh, this is going to be very nice, you're going to enjoy it, great, have fun. And the other one is, this is hard work, but it's worth it. So that's the fundamental difference about how you're trying to articulate engagement in what we're trying to achieve.
Understand. It's slightly tangential. It's not something I put on the slides, but it did sort of it got me thinking whilst you were talking, was thinking about engagement, and it's something we're exploring at the moment around the use of notifications, but
yes,
not notifications for the sake of it, but being relevant to the individual and the treatment and activities that they have to do. The research seems to suggest that that personalization is really important, rather than like you get with your Apple Health, have you checked in today? Because they're doing those sort of things now, but those personalized calls to action, if you like, seem to be the ones that resonate more.
Yeah, I mean, again, with Apple Health, we're talking about two different scenarios. So in Apple Health, you probably have recruited onto your app one of the super healthy individuals, that 10% of the population, maybe 15% if you really, really stretch it, that are very keen on doing things for their health. And for them, it's a challenge, and yeah, they want to sort of complete their streaks and things like that. And it's maybe a little bit of competition with yourself, maybe even a little bit of competition with others about who's the healthiest and who's the most active here. We're not trying to do that. We're trying to do something hard, which is, if you're depressed or you're anxious, and I remind you that you haven't done your homework, how are you going to feel? If I am like telling you, oh, you should check in to do this hard thing, and I don't give you context, and I'm not trying to motivate you to, okay, so this is about your recovery and it's important to you because you formulated this goal. So I'm just reminding you of something that is quite personal to you, that is relevant to you, that you formulated when you were sort of planning your recovery. Then it's going to probably backfire. You're going to probably disengage. You don't want to be chided to or told off in any way. You might feel that way. People in the audience might think, why would anybody feel that way? Because you're depressed, because you're anxious. So the anxious person might feel a bit attacked. The depressed person might feel a bit, oh, there's another thing here for me to fail at. So not being careful with your notifications could very well end up disengaging somebody that you could have produced a good recovery for. So what we know from research is that those notifications for people in treatment need to be very tailored to whatever it is that they're doing and their personal goals. So you need to be careful so they do work, they do help, but the right ones help. The wrong ones can easily backfire. And it's part of our research program about what is the best way to notify so that we get the engagement that I was talking about, the engagement that is, we're trying to help you, motivate you to do something really hard that you don't really want to do because it's painful. That's where it comes from. So yes, there is a way to do it. It's not trivial. Yeah.
Understand. Thanks, Andres. And as we, Andres alluded to the sort of optimization of certain apps, we'll share the slides, and you'll get the recording after the webinar, but that link below links to one of the research papers on that topic. So let's spend a little bit of time thinking about and talking about prevention. So we know for our physical health, right, and that doing a certain amount of exercise, regular exercise, is beneficial for our health and also our mental health. But I'm hearing this more and more about the role of prevention. I wondered if we could sort of approach the topic of how prevention can be an aid in terms of mental health. I know we've got a bit of a sort of diagram spreadsheet, I think, to try and bring this topic to life. Good luck with that one.
It's a bit of a matrix. Yeah. Yeah. Sorry about that. Please don't be scared. It's going to be fine. We're going to get through it. I just about prevention is actually quite difficult when you're looking at it from a mental health angle, because, for example, it used to be thought that maybe just doing a little bit of meditation is going to increase your resilience, and maybe that's going to improve your ability to sort of not ever become unwell from a mental health condition. That doesn't seem to be true. You know, that approach doesn't seem to be true. Interestingly, almost anything that has been proven to protect you from heart disease, for example, or from diabetes, those kinds of things like exercise, good diet, good sleep, those just very basic things seem to also be preventative for mental health conditions. Like, I'm not surprised, but people seem to be a bit surprised that a good health in general will be preventative of mental health. I mean, it makes very good sense to me, but people think that people are a little bit dualistic, intuitively, and they think that for the mind you need something different. No, good sleep, good diet, good exercise is good for everything in general. So if you want to go really, really simple, that's what you do, right? Now, if you want to sort of be a bit more nuanced, and you are really particularly concerned about preventing mental health conditions, you have to think about them in a more personal way. So when I interview somebody, and I'm doing a clinical interview, and I'm trying to get to the point about how am I going to perhaps treat this individual, or perhaps prevent them from becoming unwell in the first place. So because they've probably had a condition in the past, so they've had an episode in the past, and they want to prevent it from happening again, I have to use this model that you've got here on the screen. So you've got 3 columns, which say biological, psychological, and social. And then you've got 3 rows, which say predisposing, precipitating, and perpetuating conditions. Yeah. So when you're thinking about prevention, you're probably mostly thinking about the first row, which says predisposing. Yeah. And I've got a few examples of of what may be a predisposing factor for each category. They're just examples. It's just to sort of give you an idea of what I'm talking about. So, for example, in the biological predisposing, we've got FHX, which means family history. So if you have family history of a mental health condition, that's a biological predisposing factor to you developing a mental health condition. But you also have things like problems during pregnancy, and maybe even a traumatic brain injury very early on in life. Okay, so you'll see that some of them, let's imagine that for whatever unfortunate reason, you have one of those predisposing factors. You might say to yourself, well, okay, I cannot change it. So what good is it to me? It's good that you know it, and that you're perhaps more vulnerable, and then you can increase your strengths in the other boxes to try and compensate for that maybe initial vulnerability that you may have because you have a family history, say, for example. Okay, so you also have things in that box that are modifiable. For example, lack of sufficient exercise, like we were saying before, self-sleep deprivation for whatever reason, because you need to work very hard for your job, and you put in long hours, and you maybe sleep 6 hours or less. That's a risk factor that you could modify. So even though it says biological predisposing, there are some that are modifiable and some that aren't. And it's about the job of prevention there would be about identifying those vulnerabilities and try to correct the ones that are correctable, and try to be aware of the ones that aren't. Yeah. So in the psychological, we have a lot more modifiable factors. So we've got things like poor self-esteem, tendency to catastrophize, and other cognitive errors. Experiencing a stressful event, even having early experiences, traumatic experiences may be psychological. Having an early traumatic experience, you cannot modify, but a lot of the others you could, right? So that's where you can intervene in terms of prevention. But as you see, it's not just blanket, everybody's going to do something to improve their self-esteem, because it might not be your case. But if we identify it, like we do in our app, if we identify this, or in our service, this particular area of vulnerability, we could do something about it. Particularly if you're in that bracket where you're symptomatic, but you're not unwell, we could do something to do something in this area to prevent you from actually becoming unwell. Yeah, and the last one is social, and you've got things there in the predisposing column, like loneliness, social isolation, and lack of a network. How good the welfare is in your, interestingly, the welfare system in your country, and we did a study on this as well, can change your vulnerability, your predisposing factors. So, I mean, again, difficult to modify, but I'm going to be very glib, and apologies, but you know, sometimes if you move, and people do, the resilience improves, you know, to a place that offers more in terms of the care and services in general. And even if you don't use them, which is this is the most interesting thing, even if you never use these services, they still improve your resilience. So loneliness is modifiable, improving social isolation, improving developing a network, they're all modifiable. So if you're aware of these risk factors, you can do something about them. Okay? In the precipitating is what triggers it. So removing triggers might be an option in some cases. In some other cases, might not be. They become relevant when you perhaps have experienced an episode before and you know which one was triggered the condition for you. So then you can adjust things to try and prevent as much as possible something like that from happening. Or, you know, some of them are inevitably going to happen, just being aware of them. And if there's any preparation that you can do, anything that you can do to mitigate it, for example, improving the other boxes, the other factors to boost your resilience, that might pay off, right? So you may not, you know, you may not be aware that you're going to be very, that can just happen. That I'm looking at the middle column in precipitating psychological, yeah? So you may, but you may be moving houses, and you know before you do it that that's going to be quite challenging, because it's one of there's this scale that measures the impact of life changes in general, and in that scale that I'm talking about, the Holmes scale, the Holmes-Rahe scale, the moving house is actually quite high, as a high impact activity that you could do that could potentially trigger a mental health condition. So knowing about it, you could take steps to be aware that it's going to be hard, and how can I mitigate this? You know, so that's a key role in prevention. You've got things like going on medication that you're not aware is going to have a side effect on you, may trigger, but now you know it. So you that is listed as one of the triggers, and it's perhaps not for you to have it. I'll give you an example, a quick example. There's a medication that is used for high blood pressure. It does have the side effect of sometimes causing depression. It doesn't cause it for everybody, and it's actually quite an effective tablet for hypertension. So sometimes it's used, and then you end up being depressed, and you wonder why, because nothing is wrong, and it was the tablet. So now you know, and now it's listed as a sensitivity, and now we prevented a future episode caused by that factor. Does that make sense? So it's just knowing about them that is very helpful. And the last one is a perpetuating. So that one becomes relevant when you are unwell and you're doing everything. So for example, you're having your psychological treatments, you're having your psychotherapy, you may be on other treatment, you may be on even medication, and that is doing its job as well as it can. But I know that I'm not fully recovering unless I solve some of the other problems, and that working with your therapist can do it. But also, we know that if these factors, these perpetuating factors, even if you recover, are not removed, then you're likely to sort of relapse again in the future. And you might be interested to see some of the same things are listed under predisposing as perpetuating, right? Because they can be both, right? So if I eliminate them from predisposing, I also eliminate them from perpetuating. So I'm not doing just prevention, but also relapse prevention. So two birds with one stone, if I identify them and I act appropriately. So the overarching message is that prevention is not as simple as let's do meditation. Prevention can be very targeted and individual. It is about awareness. It is about what are the common risk factors. We screen for those in our service. And if you are in that bracket where I feel that you would benefit from our service, you're symptomatic, but you're not unwell, we can do a lot to prevent you from becoming unwell because of acting at that level. You are symptomatic, you are motivated to do something about it. We know that we can benefit you, and that's when we can do prevention, quite targeted prevention.
Thanks, Andres. Appreciate for the audience, there's quite a lot of things to bring together, but hopefully a helpful way to look at prevention. Now we are about halfway through the session, so some of these slides will sort of necessitate more explanation, but some of them will be a bit quicker, but I think we're about on course. But we'd like to get your views now. So Slido, for those of you that are not familiar, you basically point your phone, scan the QR code, and it gives you the opportunity to participate. Or you can go to slido.com and you can see the hashtag hopefully on the screen, 4249970. So want to get a feeling for what you as an audience do in terms of looking after your mental health. What are some of the sort of preventative things that you might engage in that help you? And we'll give that a few minutes for people.
Yeah, so yoga, it's interesting that you've got yoga and exercise. There is a studies on that, looking at whether yoga as a particular form of exercise is different, qualitatively different in terms of its preventative role from other forms of exercise. The summary, the spoiler alert, they're equal, they're of equal value. So it's not superior or inferior to exercise, but they're both very good. So walking is also another good example. So any form of exercise seems to be beneficial. Do the one that best suits your lifestyle. So some people prefer running, for example. Other people prefer walking. Other people prefer yoga. Do the one that is easiest for you, because they're all equally valuable in, when you do the research on them. So breathing techniques, they can be useful to know and understand. They reduce that overall reactivity if you're very skilled at doing them and very practiced at doing them. So that's fine. Watch easy TV, yeah. Just relaxing is good. Just giving yourself the chance to unplug, disconnect can be very good. We've got jigsaw puzzles, so just doing a hobby there is good. Mindfulness is not anymore, I will say this, is not any more preventative than other good activity that you find relaxing, if that makes sense. So some people feel terrible because they say, I don't get mindfulness. I just don't get it. I don't know. I've never been successful at doing it. It's horrible. I'm very much at risk of a mental health condition. No, it's not superior to, say, listening to music, for example. If you do a lot of it and you are very skilled at it, but then it becomes really hard, then there's something to be gained. But this is in long-term practitioners, very experienced practitioners, there is a difference. But it's at the very, very thin tail of the distribution. So the very end of the distribution, people who are very practiced, have done it for years, and they're experts. They do seem to get benefits. But maybe it's not because of the meditation, but maybe it's because they're so disciplined, and so there might be other factors there. So it's not easy to disentangle those two. Exercise, we've got all those. Breathing, getting outdoors very important. It seems to be very, very helpful in preventing. So getting outdoors gives you the exercise, but also just a little bit of exposure to the elements, sun on your face seems to be good. And I don't know if we have big time to disconnect. Socializing, that's the one I was looking for. Talking to friends. Yes, having sharing with a close one, spending time with family. That's a very important dimension of prevention. That seems to be actually quite powerful. So there we go. There's one that is not listed there. There is a form of exercise that seems to be very globally preventative, and also preventative for memory problems in the future, which is dancing specifically. And is, for whatever reason, it seems to be because it covers the exercise angle, it covers a social angle, and also because you have to pay attention to music. And music seems to be a global activity for the brain, and it seems to boost your resilience to memory problems, specifically, but also depression, anxiety, etc. So it's just because it's not listed that I thought I'd mention it. Yeah. Sleeping well is not listed, and it should be.
Oh, there is.
It is listed.
On the
Sorry.
right. Yeah,
I apologize. Somebody in the
sleep.
audience. Sleep, very, very important. Yeah.
Good stuff. Well, thank you anyway for the participation, and I certainly can resonate that thing has to be something that you enjoy to keep up that habit, so that it works. Yeah. It works for you. So I'm going to move us on. So I want you to now think from the perspective of an organization, a company, what do you think some of the things are that an organization can consider to support prevention? And same principle again, we'll spend a minute or two, no more on this, just to keep us to time. But some of the things that organizations might be able to do to support prevention for their employees. And then we'll have a few sort of top tips on the next slide. So we've got people typing.
Yes, managing workloads, yes.
Yep, support groups.
Support groups, again, definitely, but if indicated, not just if indicated. Yeah, that's important. Culture of openness and support, yes, definitely. Thrive webinars, thank you. Psychological safety, yeah, I'm sure everybody's aware of the concept of psychological safety, which means that basically you feel that in your organization, if you mention that you are struggling with anything, that you're not going to be punished for it. That is going to be something, the environment, you feel the environment is safe for you to be sharing some things that you feel you need to share. That's kind of what it boils down to. Mental health first aiders can be helpful, yes. Mental health days, well, just relaxing days, definitely. Quiet areas, maybe. Got break support, workload. Somebody says catch.
Yeah, not sure about that one, but
okay.
let's move ourselves
on. Walking
on.
Groups is very good. I really like the idea of a walking group.
Yeah, I think
not. Yeah, I don't know if you can incentivize it as much as possible. That one is very good.
Yeah.
Yeah.
Particularly when you're like us, a remote first organization, just encouraging employees, you spend a lot of your time, you're not commuting. And so getting people up, standing up, whether you've got stand desk, going for a walk, things like that, meetings be taken sort of on the move and things of those sorts of initiatives.
Regular check-ins is very important. And also I think somebody mentioned the team building. Yeah, so because loneliness can be a problem and lack of social network, work can be a very good source, very important source of connection, and your work colleagues can be very important. So fostering that, enabling that as much as possible can be very helpful, because some people might not have any other relevant access to any networks because of their personal circumstances. That's important. Yeah.
Stuff. I'm going to move us on. Thank you for those that have participated and are continuing to, just in the interest of time. So we're just recapping what many of you have contributed as things that organizations can do, and what you sort of finished on there, Andres. A lot of the time we hear work as a negative stressor, but actually it can be very much a protective factor for the reasons that you've mentioned.
Yeah, I mean, you've got it there, and it's an important source of meaning. That's something that the employer can do. If you have work that you believe has a positive impact in the world, you are more likely to be resilient and you're less likely to become unwell. Actually, that sense of meaning, which is a bit, I mean, you can define it very fuzzily, but there seems to be quite solid research if you feel that you do meaningful work, if you feel that what you do matters, you're you're much more protected, you're much more resilient. So an organization can help frame or articulate why what you do is important, why what you do helps people, why what you do has a function that people need, and you're going to sort of have a positive impact in people's lives. That's important. Yeah.
The only other thing that I mentioned that we perhaps didn't pick up on the previous was this around mental health literacy. So I guess
yes, I think people said there was somebody that said awareness, which is
okay.
Yeah.
Okay.
And so somebody mentioned our webinars. Thank you very much.
Wasn't one of us. So yeah, just understanding perhaps the early signs of mental health conditions, not only yourself, but also others. And there's various organizations, including ourselves, that do sort of training on this area. So we have 20 minutes. So I want us to briefly talk about this concept of resilience, but in relationship to prevention. Is there anything you can sort of expand there, Andreas, when we're thinking about resilience? And then I've got a couple of techniques that sit within the Thrive app that I'm going to talk to you about and sort of expand on.
Yeah, so resilience refers to to the ability of being able to encounter a difficult situation, a stressful situation, and being able to bounce back from it. There's kind of two conceptualizations of it. One is more helpful than the other. So one, and it could be the way even you frame it for yourself. You may let's imagine that you're a person that has had maybe a few crises in your life, and you came through them relatively unscathed, and then you may develop which is quite helpful. You may develop the concept of yourself that you're a strong person, let's say, yeah. So for whatever reason, maybe your biological makeup makes you more resilient. Maybe you have protective factors that we saw that are psychological. So as well as positive, they could be, as well as negative, they could be positive. Protective factors. You have a very good social network. You have, those things are there. So then you have that resilience. But then sometimes, sometime in the future, something happens and you actually become unwell. And then you might say, well, you might think to yourself, well, actually, I wasn't as strong as I thought. And then your resilience can be undermined quite significantly, because then your concept of yourself as a strong person, capable person that can withstand difficult things can crumble. So that's the less useful way of thinking about resilience. A more useful way of thinking about resilience is what can I learn from a difficult time? And so yes, those things that we mentioned before will boost your resilience. The exercise, having a good network, sleeping well, all of the things that we mentioned, having meaningful work, all of that is going to boost your resilience, improve your ability to cope through a difficult time. Absolutely. But there might come a time when that's not sufficient, and you may struggle through a time like that. The interesting thing is that, as I said in the prevention slide, that may give you information about what are the things that happen here that I could change for myself so that in the future this doesn't happen. So actually, having gone through this difficult time, in a way, has boosted my resilience for the future. And that seems to be a very good, helpful framing that is protective. So that's why that understanding of myself may happen only through a difficult time. So of course you wouldn't want to have for the difficult time to happen, but now that it's happened, what can I take away from it so that I can boost my resilience for the future? Yeah.
Thank you. So it feels right that we should showcase a couple of things that sit within the Thrive app and the Thrive service. Now, with the caveat of hopefully for those that joined us earlier and heard us talk about prevention, I want to look at this, and feel free to obviously challenge me, Andreas, if there's anything from a clinical perspective that doesn't stand up. But I want to think about this from the potential to prevent conditions moving, for example, from a mild to moderate to severe. So is there a role for the tools that I highlight, such as CBT, which we have within the Thrive app, when you think about things like modification of faulty thinking patterns, for example, the role of understanding how your thoughts, the cognition, your behaviors and emotions all interrelate, can that be considered helpful in a preventative perspective?
Yeah, for sure. So again, so if there will be the super healthy that will be interested and will go through it, and some people that are just curious about it, and they will benefit from this understanding that the model brings. The people that we showed when we showed the different boxes, and we were talking about those people who were symptomatic but not unwell, they can really benefit from this. And when we went through that complicated prevention slide, and we were showing the psychological predisposing factors, CBT can address a lot of those psychological predisposing factors. So it's very helpful in that way, in prevention from that perspective. So I wouldn't recommend it for everybody, but I would recommend it for some people that may have symptoms and may be struggling, and maybe notice that they have poor self-esteem, or they jump to conclusions, or they have symptoms, they're maybe not unwell yet, but it would be very useful for them. Again, it's okay for, it's fine for everybody, but it is hard work. And you have to have some kind of a motivation to do it. So therefore I recommend it for people that actually have a reason and a particular target. So I know that my self-esteem is not great. I know that I struggle with this. I know I struggle with that. That gives you a framework to access the module that makes sense for you. So you stand to gain some benefit directly, even if you're not symptomatic, if you're not unwell, if you're not over the threshold, you will benefit from it from that perspective. It gives you something practical back. Yeah.
Thank you. And then just to sort of highlight a couple of other things that sit within the app briefly. And for those of you that have access through your employer or potentially insurer or any organization that's provided the app, you can sort of explore these at your discretion. So there are various relaxation techniques that sit within the app. We have calm breathing, which is sort of a rhythmic breathing pattern. Breathe in for 3, hold the breath, breathe out for 3. So engaging the parasympathetic nervous system, the sort of calming effect to that fight or flight response, which can be helpful for managing symptoms. And again, you can see some of the other activities that you can do within the app. I find deep muscle relaxation really effective for me, not just to sort of calm my mind, but also to sort of take out any tension that physically manifests in the body. And we are also working on a new version of our applied relaxation module that I know has a clinical application, Andreas, for anxiety disorders and panic and things like that.
Yeah, I mean, it's a more advanced version of the simple deep muscle relaxation, which is a nice activity to do. It does have that effect that you mentioned. If you're feeling nervous and anxious, if you have some symptoms, it will alleviate them, and it's a valuable skill to have. So to learn it that way. But applied relaxation takes it a step further and transforms it into a full-blown treatment that is not about exploring your thoughts really. It's more about letting you learn how to use your body to really manage your anxiety. Some people don't really take to the CBT model at all. It's not for them. They don't necessarily feel it fits with their experience. And this is a lot more practical, and many people benefit from it where they haven't benefited from CBT. And it is as effective for those that benefit from it. It is as effective as CBT in the literature, proven to be one of the 2 clearly manualized interventions that can help with anxiety and is recommended by NICE.
Great stuff, and we're looking forward to that release later this year. And the other thing, just very briefly, and you can explore this in your own time in the app. The app becomes one, it's personalized to the individual. So based on those potential risk factors that might be identified when you sort of do the screening assessment, we will provide sort of tailored goals that support prevention. So that whether that's around sleep, caffeine, alcohol, exercise, and just highlighting some of the different ways that we support prevention within the app and within the Thrive service. So we have to be relatively brief on this, Andreas, but if you could sort of summarize, if you can, some of the impacts or the role, if you like, of early intervention when we think about supporting mental health outcomes, treatment, etc.
Yeah, no, I mean, I think we've kind of covered it already, but what I would say is that the main point of early intervention is to reduce the duration of the condition. So it also has an effect in reducing the chance of escalation of worsening. So that's important. But also it's about reducing the length of the distress or the disability that may, or both, or the risk that may come with it, right? So that's why identifying the condition as early as possible enables that early intervention, enables to reduce the time that you're going to be affected by it. So that's, I think in summary, that's the key thing. Early detection enables early intervention enables quick recovery.
Understand. And we've got some supporting resources that you can look at after the webinar that sort of are studies into various merits of early intervention.
Is exactly that, reducing sick leave duration, for example.
Yeah. So we're going to briefly show you this. I mean, more people that are familiar with the app will recognize, but the way we look at sort of early intervention within the Thrive service is we have something called the checkup within the app, daily checkup. It's essentially the ability for an individual to rate how they're feeling. And in this example, the individual's going to say that they're feeling anxious, so they're not coping. they get a visual sort of representation of the mood. And then based off the way that they answer that, they will be asked to rate the severity of that mood. So they say that they're feeling anxious and they put a severity in. And because they've done that, and this is on the sort of theme of early intervention, and we proactively lean into this process. So it will ask you a series of questions. These are the GAD and the PHQ. So generalized anxiety disorder and PHQ for depression. So we're trying to pick up as early as possible, again, thinking about early intervention. And we believe that putting this tool, a scalable way to reach people, to check in on their mental health, is a good way, backed up by these clinically validated screening assessments, for people to understand how they're doing. And for those of you that have our sort of app-only service, you will get a recommendation of signposting to different services. And then what we sometimes refer to internally as Full Thrive, we lean into that process. And what we do there is one of our therapists proactively engages, messages that individual within 10 minutes. So leaning into that process. Again, we have a very high acceptance rates of those chats, and we've talked about the benefits of intervening early in treatment outcomes. So what are some of those outcomes, Andres, that you would typically, as a clinician, be interested in? We've mentioned the PHQ and the GAD there.
Yeah, so those are self-administered questionnaires. So we look at recoveries and how do you measure recoveries, right? So there's 3 dimensions that are important in a mental health condition. Is are you distressed? Is your function being affected, and are you at risk? And if those things can be measured, then that gives you an indication of somebody who's are they well? Are they symptomatic but not quite unwell, or are they actually unwell? And what we're looking at is, once we've identified where you are we able to shift it down to being well? Are we able to shift it down maybe from being unwell to maybe being symptomatic? That is already a success. But obviously, hopefully, the goal is to get you to no distress, no dysfunction, no risk. So the PHQ and GAD measure symptoms. We have other tools that we use. Our therapists use the Global Global Impression, the WSAS, which measures function. So we have a variety of outcomes that we look at. But basically, what we need to understand is that it's not necessarily about the engagement. We know that the engagement is a factor, an important factor, to get the outcome that we want, which is the recovery. So that's why it's important, and that's why we measure it, right? But the important thing is, have they recovered, and how do we measure recovery? Okay, so let's imagine that we improve a lot our service, we make it a lot more efficient, okay? And instead of needing to complete the full 20-something sessions that we have in our CBT program, we can do it in 5. Well, I'd rather do that, because then I get a faster recovery, and I produce my real outcome faster. Even though if you measure the engagement, it might seem lower. Now, if I measure the engagement as adherence to treatment, I may actually get a higher number, because even though they've only done 5 sessions, it's more likely that they will complete 5 than 27, if that makes any sense. So I'm just trying to sort of communicate to the audience that deciding what outcome you're measuring is very important to guide you to what is a good result for your service and a bad result for your service. For us, the most important thing overall is the fastest recovery that we can attain. That's what we really want.
Thank you, Andres. Yeah, hopefully a helpful message in thinking about outcomes and the relationship of engagement to outcomes. We do, within the Thrive service, we provide data back to the employer. So, typically we know that from an employer's perspective, or maybe you're one of those individuals that's responsible for service that's Thrive or a similar service, we know that measuring these things and being able to report on them is important. So this is a very quick sort of skip through the different things that we look at, from the prevalence of mental health conditions, so those screenings that you saw within the app, through to those improvements, so who's gone from moderate to mild, etc. and who's recovered. And using that data, which is kind of, well, we've got one more penultimate thing to talk about, but before we finish on, I do want to speak about the way that we typically look at measuring impact, going beyond the human impact. Obviously, we're all motivated here at Thrive to deliver that human impact, but it is important for organizations to understand that they are getting, for some organizations, to get a feel for a return on their investment. So I'm going to do, hopefully, if the slides let me, is very briefly touch on this. So we spoke about, this is a recap. So we spoke about some of the clinical measures that Andreas mentioned that we may use to evaluate how an individual's doing, whether they've recovered. The thing that is on the horizon for us, and I know is very much something that you're wanting to get out there, Andreas, is this health check whereby we can survey the employee population to understand the prevalence of need within that population and then measure our impact by targeting those individuals that we know need our service. So this is something that we're going to be working with our clients to roll out. And then I guess you have more quality.
Just very briefly, is to identify in a population, we've got that estimate that you saw at the beginning, X many with symptoms, X many unwell, X many well, is to be able to actually know what it is in your population, so that instead of like saying we need to engage about 15% and then probably we're okay for the unwell and another 15% for the symptomatic, now we know, and we can measure our impact and report our impact back to you a lot more clear and a lot more personalized to your company and your setting.
Perfect. The final thing is just looking at, I guess, the financial side. So we've discussed around the human impact of these interventions and the benefits of making these available. But obviously there are, particularly, you know, in the economic climate that we're in, where organizations are having to think very much about their cost base, it's helpful that we can contribute to their evaluation of impact and how these services are helping people. So the way that we do this and support you, if you like, is looking at one angle around absenteeism. So various different ways that you can think to measure impact of services, from prevention. But we know that absenteeism, that being people that we help prevent going off with mental health related challenges, is one measure where we can potentially use the data that we have. So the recoveries that we track within the Thrive service. So we talked about the PHQ and the GAD, those clinically validated assessment scales. We can tell you how many people within the employee population have recovered. And then what we use is HSE data, so Health and Safety Executive. They have an average, it's just increased 21.1 days per case of ill mental health. We calculate a days prevented in absenteeism, and then we use UK average salary data, or if we have the organisation's salary data themselves, we can give you a feeling on the potential cost savings relating to absenteeism. Obviously, there'll be individuals that will be getting benefit outside of those recoveries, but it gives you a bit of a flavour for some of the financial ROI that interventions like Thrive can deliver for you as an organisation, as well as the human impact that we deliver as a service. So that brings us to the end, and considering that that's the first time we've ran this deck, I think we've just about managed that in ample time, hopefully giving people or spending enough time on the topics that we said we'd talk about and bring those to life. I'd like to thank Andreas for sort of bringing the clinical lens to this discussion, and also to all of you that have attended. Recognise this is a slightly different approach and potentially audience that have attended today, but hopefully you found the discussion useful, and we will be sharing with you the slides and recording. And hopefully you can't hear my dog barking in the background too much. But yeah, thank you very much for everyone that's attended. Hope you have a good afternoon, and thank you for the comments. Just seen one in the chat now, and yeah, we'll
thank you all very much.
do a good afternoon. Thank you.